Good morning, good afternoon, good evening, everyone. On behalf of the Economics for Health group at Johns Hopkins University, the University of Cape Town, ONE, and Vital Strategies, welcome to today's virtual briefing on our new publication, Future of Health Financing in Africa, the Role of Health Taxes. My name is Adam Karpati. I'm a Senior Vice President at Vital Strategies and one of the authors of the report. And it's really my pleasure to be moderating today's discussion. The publication describes the context of health taxes in Africa, focusing on three high-impact product types: tobacco, alcohol, and sugar-sweetened beverages. These are major contributors to the continent's non-communicable disease burden, and targeted taxes on these products can deliver outsized benefits. We're using the report today to delve into this broad topic. We'll include a discussion of the report's findings and invite broader insights into the current landscape of health taxes in Africa, highlight some country case studies, and offer evidence-based policy design recommendations. You'll be hearing from four esteemed panelists: Marianne Etiebet, President and CEO of Vital Strategies, where she leads a team of over 400 people working in over 80 countries to advance public health systems. She's a global health leader with decades of experience advancing health equity and maternal health worldwide. Next, we'll hear from Corne van Walbeek, Director of the Research Unit on the Economics of Excisable Products at the University of Cape Town, which is dedicated to advancing knowledge and evidence-based policy on products such as tobacco, alcohol, and sugar-sweetened beverages. Corne is an expert on tobacco taxation and has supported more than 20 countries in improving their tobacco tax systems. We're also joined by Jeffrey Drope, Research Professor in the Johns Hopkins Bloomberg School of Public Health and Director of the Economics for Health program, which supports the Reset Alcohol Initiative and the Bloomberg Initiative to reduce tobacco use, through a global initiative to build capacity on health taxes with economic think tanks and governments. And finally, Sarah Maka, Executive Director for Africa, ONE. Sarah, with an extensive background in global development and foreign policy, leads ONE's advocacy and strategic engagement across Africa. At the end of the presentation, we'll have time for a Q&A, where I'll be joined by my colleague, Ellie Davis, Deputy Director at Vital Strategies for Public Relations. For the Q&A, please type your questions into the Q&A box, and we'll aim to answer as many as we can. In particular, if you're a journalist, please identify your media outlet. If we don't get to your questions during this session, we'll reach out to you directly. We're going to be recording this briefing and sharing it out later this week. Thank you again for joining us today. I'm looking forward to a stimulating discussion, and I'm going to turn it over to Dr. Marianne Etiebet to kick off the panel. Over to you.
Thank you, Dr. Karpati, and good morning, good evening, good afternoon to all of you who are joining us today. And thank you for joining us at what is such a critical time for securing a future where we can all be supported in living our healthiest lives. I'd like to start by sharing the burning platform, that we are all living in right now. One where non-communicable diseases like heart disease, lung disease, cancer, diabetes account for well over a third of deaths on the African continent, and they're predicted to surpass infectious disease deaths by 2030. Diabetes alone will more than double to 47 million cases by 2045 if nothing is done, and the clock is ticking. This burning platform does not only relate to our health of our bodies, it also relates to the health of our economies. Low and middle income countries are at risk of losing up to $21 trillion by 2030 if no action is taken on the prevention and control of non-communicable diseases. We know that on the African continent, external health aid is falling sharply and is projected to fall even further, tightening fiscal space and reducing budgets available to support country health needs. And so as governments are faced with this conundrum of rising health needs and diminishing budgets, we thought it would be an important opportunity to share findings across the African continent on what leaders are already doing to advance health taxes in order to address this burning platform. Top of mind for me are two key moments. Recently, in July, the 4th International Conference on Financing for Development in Seville endorsed health taxes as a key innovative vehicle for strengthening fiscal health and providing domestic revenue to address social issues like health. And secondly, in September, we have the upcoming high-level meeting on non-communicable diseases and mental health during the United Nations General Assembly, where global leaders will come together to commit to certain provisions for reducing the global burden of NCDs. As I mentioned, we are at a critical junction because right now the revised version of the proposed declaration has weakened commitments with regard to health taxes. And this upcoming meeting is really a crucial opportunity to secure bold evidence-based global actions that will save lives, prevent illness, and deliver significant economic benefits. Many of you may know that last year, the Task Force on Fiscal Policy for Health identified that by just raising the prices of tobacco, alcohol, and sugary beverages by 50% could raise $3.7 trillion of revenue in 5 years and save 50 million lives by 2050. Our mission is clear, and I'm glad that you are joining us on this webinar to advance this mission. We must use these essential moments coming up to galvanize action on health taxes. The finance community has endorsed health taxes. Let's make sure that they are also endorsed by the public health community in the upcoming high-level meeting. And so with all of this explanation, of our burning platform, wanted to share again why this is the right moment for this report. And we are so proud, as Dr. Carpetti has mentioned, we are proud to have launched this report with the help of the Economics for Health unit at Johns Hopkins University and REEP at the University of Cape Town. And I can't wait for you to hear from our co-panelists and authors about the findings in this brief. At the highest level, the report gives new depth to the triple win of health taxes for Africa. That is the win around increasing domestic revenue, the win around reducing long-term health system costs from the reduction of NCDs, and the lives that health taxes will save in the long term. And I think the key takeaway from this report is that so many countries, over 90% of countries across the continent, already have some sort of health tax or levy in place. So I'm going to say that again. Over 90% of countries across the continent already have some kind of health tax in place. But the opportunity in front of us is to make sure that countries are able to maximize and optimize that triple win that health taxes can create for their citizens and for their country. And with that, I do want to hand over now to Corne, who will share with us, some of the key findings of the report. So over to you, Corne.
Thank you very much, Mary Ann. And I'm really delighted to be able to speak to you this evening. I'm speaking from Addis Ababa, but I am actually usually based in Cape Town. So I am going to talk about a technical topic, and that is about tobacco tax structure. And this is not only applicable to tobacco taxes, it's also applicable to alcohol taxes and to sugar-sweetened beverage taxes. And I think there's a lot of knowledge that is known about tax structures at this point in time, especially regarding tobacco taxes. Over the past 20 years, a lot of work has been done, a lot of research has been done, and there's pretty much a consensus about what is the best tax structure. So the best structure is typically a specific tax where a certain amount of dollars is charged per pack of cigarettes. So in other words, it's not about the value of the cigarettes, it's not about the length of the cigarettes, it's the pack of the cigarettes or the cigarette itself. Similarly, we have a situation where a specific tax is also regarded as the best tax system for both alcohol and for sugar-sweetened beverages. If we go back to the tobacco tax system, the Economics for Health team have developed the cigarette tax scorecard. And this summarizes some of the best thinking in terms of what is a good tax system. And one of the dimensions of this tobacco tax scorecard is the type of tax structure. And clearly what comes out is the best tax structure is a specific tax, alternatively a mixed tax structure where you have a specific tax and an ad valorem component, but you are also subject to a minimum specific floor. What that means is that cigarettes are going to be subject to some form of minimum taxation, irrespective of the value of these products. In terms of taxing alcohol and sugar-sweetened beverages, this is less researched over the last 20 years, and the consensus is still building. But the provisional consensus at this point in time is that you want to focus on the harmful ingredient. In the case of cigarettes, the whole cigarette is the harmful product, so it's not possible to try and tax the tar or the nicotine or any sort of component of it. It's about the product as such. But if one looks at something like alcohol, you want to focus on the alcohol in the alcoholic beverage. The alcohol in the beverage is the thing that causes the harm. So if you can create incentives for people to consume less alcohol, that would be a win for public health. The same thing is true for sugar-sweetened beverages. You want to tax the harmful component, which is the sugar in the beverage. So what you do is you specifically focus your taxation on that harmful product, and in that sense, you are trying to reduce consumption. So of course, the mechanism is very clear. You increase the tax, that increases the price, and that through the well-known law of demand reduces consumption. In the case of tobacco, this all happens through what we call the demand side. Consumers are going to respond by consuming fewer cigarettes when the price of cigarettes goes up. What alcohol taxation and taxation on sugar-sweetened beverages allows us to do is to actually also create a so-called supply-side incentive. And what we mean by a supply-side incentive is if we develop and structure the tax in such a way that suppliers have an incentive to reduce the volume of the harmful substance in the beverage, what that's going to then do is make that product less harmful. So let me give you an example. In the case of South Africa with sugar-sweetened beverages, we introduced a sugar-sweetened beverage that was levied on the number of grams of sugar in the beverage in excess of 4 grams of sugar per 100 milliliters. What that meant is that there was an incentive created for the producers of sugar-sweetened beverages to reduce the sugar content and thus avoid the tax or reduce the tax burden in that sense. And what we found in South Africa was many products had a tax content, had a sugar content of 10 grams per 100 milliliters or more. We see that since the imposition of that sugar-sweetened beverage tax, the sugar content has decreased to less than 4 grams per 100 milliliters. That's not by accident. That is the industry responding to the incentive that has been created by the government in order to reduce their sugar consumption. A similar kind of thing happens with alcohol. In South Africa, beer is taxed in terms of the volume of alcohol, not in terms of the volume of the beverage. And what we see is that over the last 20 years, the beer producers have produced premium products with lower alcohol, which carry a lower tax burden. So if I can finish off, the bottom line is that tax structures matter. Often we speak about, let's increase the tax. Yes, that's a good idea. But before we increase the tax, we must look at what is the tax structure on these products, and we should rather look at fixing the tax structure if it is an inefficient or a bad tax structure rather than a good tax structure. There's a lot of literature and a lot of experience on what are good tax structures, and it's, I think, very useful for governments to think hard and deep about what tax structure they are going to be implementing. Thank you for this opportunity. With this, I'm going to give it to my next speaker. Thank you, Jeff.
Over to you, Jeff.
Thanks, Adam. Thanks, Corne. I'm going to take a slightly more global perspective here. And I just want to say that broadly speaking, what we're seeing is fairly slow progress on improving these three major health taxes: tobacco, alcohol, and sugary beverages. And I would say, as Corne suggested, the great success generally has been, or the greater success has been with tobacco, although I would say it has been uneven. But that said, there have been some really great successes, including in the African region. And I'm going to call out Ethiopia and Cabo Verde as two of those. And I want to just maybe go to Corne's point here. Cabo Verde had not a very good ad valorem structure, mainly ad valorem structure, and they changed their structure and to a specific tax, as Corne was advising, and raised their rates significantly. And they're really reaping the benefits in terms of higher tax revenues and lower smoking prevalence. Unfortunately, however, a large group of countries have only improved their taxes incrementally or not at all. Some, unfortunately, have gone backwards. And in some cases, alcohol taxes don't even exist in some countries. So the world has a long way to catch up. Africa has a long way to catch up here. But I want to maybe reshape the narrative here, and let's look at it quite differently. This means there is so much opportunity for basically every country in the region to reap these rewards. So this is really untapped potential to raise revenues and have these positive effects on public health that you heard about from Marianne. And we do see countries all around the world who are implementing the things that we counsel and enjoying great success. I'm going to congratulate Vietnam's Nationally, which just a month or two ago voted to change its flawed tobacco excise tax structure, move from an ad valorem to a mixed system, and to raise their rates significantly beginning in 2027. They also raised the rates on their alcohol structure, which was really good to see, and they introduced an SSB tax for the first time. So we see countries starting to make these moves and starting to do the things that we suggest will almost certainly help them. As a community, I would say that we have maybe gone about this backwards, that we've been very reactive, and we often let these industries shape the narratives that predominate in terms of the discussions around health taxes. And I think it's time for us to really take this narrative back. So permit me to tell you how I think we should consider shaping these narratives. The first is, we know that health taxes work. This is the bottom line. When the taxes go up, the prices go up, and consumption of these products goes down. This absolutely works. And it works across all of these different product types. We know that, for example, for tobacco and alcohol, that a 10% increase in price will lead to around a 5% decrease in consumption. That's a lot. And if you think about the fact that a lot of these countries are raising their taxes and prices a lot more than 10%, you can see that the effects on consumption are going to be enormous, and that the public health rewards are also going to be enormous. As well, these are inelastic goods. So we see that the proportion of change is different between the increase in price and the decrease in consumption. And what this translates into is huge increases in tax revenues. And this is, again, what Marianne emphasized at the beginning of this conversation. We have so much potential to get a lot of revenue, and these revenues can be reallocated towards good things like health and education. The second part of the narrative has to be that health taxes are progressive. We know that people of lower income and young people tend to be much more price sensitive, which means that they are more likely to cut down or to quit when there are tax or price increases in these products. And they are going to be the ones that reap a greater reward from these changes, because they're consuming less and they're gaining all of these rewards in terms of better health and better personal economy, if you will. And For the folks struggling to cut or quit down, and that happens sometimes, we can take some of these new tax revenues and allocate them towards helping these people. Many countries have these types of programs and do them well. Cessation programs, programs to help people cut down on alcohol consumption, etc. Another part of the narrative has to be that health taxes are generally excellent for increasing employment. They actually create jobs. These industries tend to be very capital intensive, which means we have giant factories with almost nobody working in them. And so when consumption goes down and these factories start to diminish their production, consumers are going to reallocate their spending to other sectors. And almost always what we see in the research across the world, including in Africa, is they allocate towards more labor-intensive sectors like health and education. And so we see net huge increases sometimes in jobs. And just to give an example, in 2023, Pakistan had a very large tax increase. And when we crunched the numbers with our colleagues at SBDC in Karachi, we found out that in fact, tens of thousands of jobs are created by these types of tax increases. So it is a very good thing. And the last point I want to make is that illicit trade is really not the problem it's made out to be. It is completely overblown. And more importantly, what we see is that we have really good remedies for dealing with these types of problems in terms of illicit trade of these products, particularly tobacco and alcohol. And I'm going to call out the country of Montenegro, middle-income country in the Western Balkan region. They, since 2021, have steadily raised their tobacco taxes, and this has led to really good public health effects. But at the same time, they chose to secure their supply chain for tobacco products. And this led to a huge decrease, more than a 50% decrease in illicit products and huge tax revenue increases. So basically, they followed the counsel that they were given by experts. And lo and behold, they're reaping the huge public health and public finance rewards. So in closing, what do we see over and over again, whether it's Cabo Verde or Ethiopia or Vietnam or Pakistan or Montenegro, we see that these tax reforms of these different unhealthy products really work. You reap these enormous public health rewards and the fiscal benefits. Thanks. Over to you, Adam.
Thanks very much, Jeff. And now for the fourth panelist, we'll turn it over to Sarah.
Thanks, Adam. I'm just building on the points that Jeff, Corne, and Marianne had made earlier. So for the continent of Africa, the picture is there's a similar burning platform per Marianne's initial analogy. Health taxes is proving to be a way, a pathway to health resilience for the African continent. We also, what happened during COVID, one of the takeaways from the COVID moment was Africa really does need a lot more resilience in financing its own healthcare. We're also seeing an all-time and low, declining support for health through donor aid, and it's a 13-year low. During COVID, there was a spike, but it's on a 13-year trajectory low. And this year, more than ever, we see the decline in health funding, knowing very well that human capital development, healthcare, education, the pinnacle and the foundation for a solid economy. So taxes becomes a really important pathway for Africa's health resilience. We've also seen several of the Pan-African bodies. The African Union Agenda for 2063 has called for self-financing and resilient health systems. We've seen the Lusaka Agenda, which is the Pan-African Agenda for Healthcare, calling for increased domestic resources. But in this increased domestic resources, it lends the question where African government's going to get this from. Currently, we know that 24 African countries are at risk of debt distress. We know that 34 pay more to service their debt than they do to health or education, or health and education combined. So when you sit before a president of an African country and you say, hey, we need more money for domestic resources, he or she, usually it's a he, is scratching their head and saying, where are we going to get this money from? And this is where the innovation of taxes comes in. Because again, it's been proven to provide more resources. Jeff laid out the countries for which there's been increased revenue from taxes on sugar, tobacco, and alcohol. Given the innovation required for this moment for Africa, it behooves countries, civil society, citizens alike to look at where the opportunities for more investments can come from with taxes. I have to also say that taxes are synonymous with trust. So as a member of civil society, for you to raise taxes on any product, it requires a lot of communication. So we must communicate with the citizenry as to why we're raising the health taxes. And importantly, because there is such a resistance to increased prices of any nature, whether elastic or inelastic, the population must be communicated how these funds will be spent, and there must be a transparent through line from the increased taxes in a product and development that can be seen, felt, and experienced by citizens. So this is one way governments can circumvent a perhaps resistance to taxes, because a communication channel must be established and a transparent link to how these funds are spent must be established. There's a hypothesis that taxes, people have an allergic reaction to the word taxes. But we've seen, however, in some African countries that there is an openness to paying taxes where people can see what it's used for. We saw this in Freetown in a different tax bracket, which is property taxes were raised, and people were offering to pay taxes because they could see roads were being improved by their taxes. So I employ governments now, because the moment is now to use these innovative tools to increase development, seen, experienced, and felt development. I'll add two last things. Regional taxes is also a strategy for greater health resilience. We know clearly that the strength of a country in Africa is a function of the strength of its neighbors. Health, we saw, as we've seen, healthcare requires investment, and viruses or pandemics know no borders. So the regional approach to health taxes is also one we're seeing in West Africa. The conversations with Liberia, Sierra Leone, on perhaps this ecosystem approach to taxes. We're also seeing that the West African Health Organization is looking at how we can increase health security through health taxes for universal health coverage. So regional action on health taxes is going to be very important for Africa. And finally, there is political alignment. So this is the time, this is the moment. We've seen countries like Ghana, South Africa, Nigeria, Kenya already exploring and implementing excise taxes. I think this report provides a great model for how to design taxation that is world-class and can reap the benefits of the investments that are employed for these taxes. So we know that health taxes are not a question of if they work, but how fast and how fairly we can implement them. With the 24 countries in Africa at risk of debt distress and over 30 spending more on debt, on healthcare and education, we can't afford to overlook one of the most immediate, scalable, and impactful financing tools available through health taxes and duties. And with that, let me pass it over to you, Adam.
Thanks very much. Thanks to all the panelists for those remarks. And now we'll do some follow-up questions. I'll remind folks that you could use the Q&A box, not the chat box, but the Q&A button to put further questions in, and we'll try to get to as many as we can. But we'll do a round back around our panel. Over to you, Marianne. We're talking really about taking the evidence that we know, taking what we know works. That's been a theme, and encouraging and supporting governments to do it. What are some of the key strategies that you see to move from the evidence to action?
Yeah. Thank you so much, Adam. And I think, as you mentioned, we heard from our panelists that it's evidence-based. We know it works. We know how to do it. Many countries are leading the way. We know it can be done. And as Sarah mentioned, we know the public is also behind health taxes. And I want to emphasize that point, because public polling, including some public polling done by Vital Strategies, shows that, over 2/3 or 3/4 of population sampled, whether in Kenya, in Tanzania, in Brazil, in Vietnam, there's overwhelming public support for health taxes. And so when they are well designed, when there is accountability mechanisms in place to demonstrate how taxes are being used to benefit the public, They are not just a revenue tool. They're also a tool to build public trust between government and civil society as a means for delivering on visible benefits. So I think, Adam, your question is also related to, so if they're so great, why isn't everyone doing them, and why haven't we done them already? This is a triple win. How many things are win, win, win? And, I'm not a sports fan, but, it should be a slam dunk. Why not? And, I think the critical driver behind that is industry and industry interference. And part of what we want to do as a community of public health advocates is make sure that we are fixing the price tag on health, and that the public should not be paying in lives lost and years of ill health for what private companies are profiting on. We need to put the cost where they belong, and that's back, into the private companies that are making these harmful products. And so we need to counter industry pushback. We need to prevent interference in the policymaking process, both at the global level and at the national level. And we need to counter the myths. And, I think that there are three ways that we think about countering these myths. And, I've put them together in the 3 C's. So one is, how do we create more credible country data? Every country wants to understand, what does this mean for my country? Is this applicable to my country? What are going to be the benefits in my country? And what may be some of the potential cost? And so it is really important that we have country level data and that we can share country level data with teams in countries, often multi-sectoral teams that are thinking about this and wanting to advance this. And thus, one of the tools that are publicly available is something called CORE, which is the cost recovery and revenue estimation for tobacco taxes. It's something any country can go at, plug in, the name of the country and have an estimate given of both revenues and life saves, health benefits from implementing tobacco taxes. We need to get to a place where we have the right type of data to be able to do that for both alcohol as well as sugary and sweetened beverages. So that's the first C, credible country data. Second C is around cross-ministry coordination. As you've mentioned, this is a triple win: financial benefits, health benefits. In countries, we have multiple ministries that are touching those two things. And so we need to make sure that these ministries are talking to each other, Ministry of Finance with Ministry of Health, but also the ministries that are involved in tax administration and that would be impacted, by these tax changes. And so what we have found, and some of the stuff we have shared in the briefing, is that there needs to be attention paid to coordination, communication, and collaboration across these sectors and across these ministries. And another thing that we have seen that is very helpful is how we can actually connect peer-to-peer networks for learning across countries, because again, we don't have to duplicate efforts. We don't have to reinvent the wheel. Sarah mentioned, the question in front of us is, how do we accelerate progress? And we accelerate progress by sharing what already exists that can be applied, to different countries. The third C is confusion. How do we tackle confusion around health taxes that has been created by opponents of health taxes, whether it's about jobs, the potential economic impact on different socioeconomic levels and illicit trade. Again, please take a moment to look at the brief, because this pushback is nothing new. And we have evidence that does not support these claims and these myths. And these can be used in your communications, whether within ministries or with the public to push back on this confusion and the myths around taxes. And so I think, as many of the panelists have shared, this is really low-hanging fruit for what I keep on saying should be a slam dunk, around how do we capture these enormous health and economic benefits of a mechanism, of a solution that actually doesn't cost anything. There's no upfront cost for this. And so what we are really hoping with this brief is to be able to start to share that evidence, that information, these networks of tools and resources that will support and accelerate Africa being able to leapfrog with both health and economics by using this critical policy lever of health taxes.
Can I just add one, just to reinforce a point Dr. Marianne made around the cross-country collaboration? Taxes is the ambit of the Minister of Finance. And we're talking about health, which is the ambit of the Minister of Health. And oftentimes that's where the rub is. So for advocates and technical advisors, understanding where both ministries sit and what they need is really important. So the Minister of Finance wants money, but he wants to apply it to as many departments that are required. So earmarking it for health can be a bit of a struggle. So I think to be clear-eyed about the tension of not increasing the taxes, but applying the taxes towards a specific department can be high. So going into a country or speaking with a government, being able to sort of thread that needle is important. Being able to speak to the perspective of both ministries is important, and making a case for healthcare is also really important. I just wanted to add those.
Thanks very much. And just to pick up on that even further, I think it sometimes can be perceived that because we're talking about taxes, this is the domain of the finance ministries or the treasury departments. And where does the health sector fit in? Where does the Ministry of Health fit in? And I think because of your point that this really needs to be a multi-sectoral, cross-sector approach, it's really critical that the public health community, the government and civil society step up and emphasize the substantial public health benefits of doing this and what the burden of non-communicable diseases is, the hundreds of thousands of lives that are being lost every year due to NCDs on the continent. And really have health be at the forefront of supporting ministries of finance. And it's together making that argument about health and revenues that really works, that's really necessary. And I think it's something that colleagues on the finance side really look for, really want health to step up. Corne, could I turn back to you and ask, I mean, you've made a compelling point that the rates of taxation matter a lot, but the design also is critical. And there are a lot of questions and comments in our Q&A about elements of tax design. Could you expand on any other key strategies that are really important for design? Folks have mentioned, and Sarah mentioned, this issue of ring fencing or trying to maximize the direction of the revenues in certain areas. Maybe address that and any other design elements that you'd like to talk about.
Okay, yeah, thanks, Adam. And I'm fully aware of the time, and I see that there are really interesting questions that cover this. So the excise taxes are levied at not at the retail level, but they are levied on the producers. And why would we do that is simply because there are not so many producers, whereas there are in most countries millions or potentially millions of consumers. So from a tax administration point of view, it is appropriate to tax it at a point where there are relatively few taxpayers, and that would be at the point of production or the point of import. So another aspect that I'd like to just briefly talk about is the importance of regular adjustments in the excise tax. So inflation would erode the value of the excise tax quite quickly if you don't adjust the specific tax on a regular basis. So you want to account for both inflation and for the fact that the country's economy is growing, that people's incomes in general is increasing from one year to the next, of course, with some bumps in between, and so on. So you want to make sure that the excise tax increases are such that you are able to reduce the affordability of the product. That's the long-term goal, and that's one of the very important pillars of the cigarettes tax scorecard that we have in by EFH. Another thing that I'd like to just allude to, and some countries have done it very successfully, others less so, excuse me, is to have a tax roadmap. So a country like Australia, they came out and said, for the next 4 years, we will be increasing the excise tax by 12.5% over and above the rate of inflation. And then when that 4 years was finished, they said, we'll do this again. And what that creates then is a degree of certainty. It creates a degree of certainty both for the tobacco industry. They know what the rules of the game are. They're not gonna fight with you because it's already been set to some extent in stone. But it also creates certainty for consumers, where consumers say, this is not ever going to become any cheaper. This is going to become more and more expensive. If I want to take the step of quitting, now is a good time, probably a better time than to do it in 2 or 3 or 4 years' time when I've lost even more money in that process. So I really want to just emphasize that. Critically, other important issue is that of tax administration. You want to have a strong tax administration system in place. Jeff spoke about the issue of illicit trade, and I fully agree with him. The tobacco industry has a strong incentive and typically does greatly exaggerate the illicit trade in a particular country. In some countries, it's a real problem and it needs to be addressed. And it needs to be addressed as a criminal issue, not as a tax issue. And I think that's the critical thing, that we don't try and make this link between an increase in taxes is going to lead to an increase in illicit trade. That is an industry argument that is, in 99% of cases, not true or highly exaggerated at the most. So, Adam, I will stop with that one. Thank you.
Great, thanks so much. One last on our roundabout to you, Jeff. Just you spoke very compellingly about some of the issues that get raised around taxes. You and Corne and other experts interact a lot with ministries of finance and with country partners in think tanks and universities that in turn are talking to government a lot. What do ministers of finance need the most? What do you hear that is most helpful, and what are some of the concerns or the barriers that you hear from colleagues on the finance side the most?
It's a great question, Adam, and it speaks to the broader challenges we've been hearing from all the panelists here, and that I'm seeing in the question and answer box as well. It's hard. This is not easy. Convincing folks to raise taxes is not as straightforward as it appears on the face of it. You think, well, of course you should do this, and we don't. A lot of it, as Marianne suggested, there's a tremendous amount of industry influence here because it's existential threat to them. This is the thing they most worry about at night, is this, which suggests to us this is exactly what we should be doing. We want existential threats to them. And when we have conversations with our finance ministry colleagues, I'll be honest, they mostly care about revenue because that is their mandate, and so they are trying to generate money to fund the budget of the government. That is their job. So they're not that interested in earmarks. Sometimes they're actively opposed to them because it gives them less flexibility. They're not super happy about it. They're trying to make the money that has been put forward to them by the executive or the legislative or both branches, and that's their job. What I do find is that most of these folks are very smart. Many of them are very well educated and thoughtful. They will listen to you. They generally can see what we're saying and are open to it. A lot of time, I'll tell you what they need is some political cover. They need support. So they might be quietly very, very pro health taxes. and would like to implement them, but they also recognize the political reality of a very powerful industry that has a lot of influence, often over legislators or even executives. And so they're mindful of, frankly, their own jobs. And I think what they need, and this is what we try to provide through coalitions in many countries, is to give them that help, to get this broad type of public and public-private support to the ministries so that they can do their job. And that job is to raise those excise taxes, generate more revenue, and then we get these amazing follow-on effects that have been described well here.
Thanks. And that's a nice, and maybe we segue over to you, Sarah, what that political cover, that driving the narrative. The other important group to think about are legislators. Marianne talked about some of the communication needs. What do you see as the best ways for mobilizing that political will and overcoming some of these narratives, counter narratives? These, I think, are some of the themes we're seeing in the questions.
Yeah, no, I think it's a good question, and Jeff is spot on. A lot of good actors within governments want to do what makes sense, and they can see the sort of the writing on the wall, but the political cover is really important. That's where civil society comes in. That's where advocates come in. And advocates, local advocates that understand the terrain of a country are really powerful, because what you can do is you can make the case for who will benefit when these taxes are applied. And oftentimes, because taxes is progressive, we want to ensure that the lowest within the economic cadre are the ones who benefit from taxes from these products. So having a sharp eye to that community is very important. The second is a transparency and accountability. I mentioned this earlier. I can't overemphasize that what we are seeing is a trust deficit. The reason for political cover is we don't really trust what the government is going to do with our money, right? So how do we increase that trust coefficient in this analysis, in this conversation? And I think transparently explaining where the funds are going, having that through line between 8 million was released through this tax, and 8 million or X amount is going towards this road in this community, or insurance for the Okada drivers who are the most exposed because they're the ones shuttling people up and down, or the bus drivers, or the hairdressers, or the market women, becomes that, as Marianne mentioned, an opportunity to increase dwindling trust within the system. And it can be very powerful because if we have a lot more trust in the system, we get a lot more things done quickly. So having advocates hone down on the trust issue is going to be important. And there's a fix for the trust issue. Openness and transparency is the fix. So I think advocates are in a really good position to make that case. And thirdly, I think healthcare as a sector is getting a lot less funding today. We saw what happened with USAID. I mean, many countries have been advocating for reduction in ODA in healthcare, but no one expected it to happen overnight. So where we have communities that do not have enough resources and are being and medication are being not available for these communities today. So yes, while there's a lag effect for health taxes, there's a community that needs support today, and taxation for that community to support the healthcare is important. Not to speak about what healthcare is for an economy. So yes, when we talk about healthcare, I often think we put it in the ambit of the health minister. I think that's a fallacy. I actually think there's a moment to reframe where health belongs. Health belongs with every single ministry: Minister of Agriculture, Minister of Water, Minister of Women, Minister of Finance. Like, that's where health belongs, because we're dealing with people, and people are the unit of development for an economy. So why is it relegated to one ministry? So rethinking how health is perceived will be really important, and advocates can make this case well. And I think political savviness per country is important. And as advocates, when we enter a country and we're making a case, there are a few things you balance out. You balance out the political tenure of a government. What's their runway for making an impact? Because we understand the currency of government is winning elections and appearing good across the people. We're not naive. So how do we use this moment to help them win scores for whatever that tenure looks like? what's the role of parliamentarian? Adam, you mentioned it earlier. They could be strong allies as well as checkers to executive. So using those allies in that community to bolster a point. And lastly, communicate, and over communicate. I think taxes gets a bad rap over the years. I think maybe the origin of taxes wasn't so great. It was almost like overlords saying, you either pay me this money or we take your land. So I think it's had a bad rap from time immemorial. I think it's time for us to sort of refrain taxes and communicate, lead with the benefits rather than the costs, especially for the audience and the community we seek to serve. As an advocacy organization, One Campaign is working on several, is working on several countries on taxes. And we are sure, and we have several offices within the African continent, but we partner with local entities because they're in the best position to make these calls, and we provide them sort of the talking points and the arguments that they need to make. I'll end here.
Thank you. Thank you very much. We just have a few minutes left before the hour. Thank you for all the questions, the thoughtful questions that have been put into the Q&A. I'll ask my colleague, Ali, any one or two we want to pull out for the panel before we wrap up?
Yeah, thanks so much, Adam. I think this first question, since tax structures are determined at the national level, could panelists speak to the role of multilateral policymaking on health taxes? For example, the upcoming NCD political declaration happening in New York for UNGA. What could that document ideally accomplish? Is that something, Adam or Marianne? I'd love to pass that to you.
I mean, I think, this is a big moment because the United Nations will be addressing non-communicable diseases in a very explicit way in the upcoming meetings in New York later this year. And this process is one that becomes endorsed by countries around the world and becomes really a set of expectations and commitments that countries are making. So it's critical that we take this opportunity, the global we, take this opportunity to be very explicit about the role and the need of increasing health taxes in the context of this global meeting. It needs to be very clear. It needs to be unambiguous. There will be a political declaration that is released that documents the country commitments that are all ratified. And it's extremely important that health taxes are referenced in a very explicit way.
Great, thank you so much. Jeff, I believe this is probably for you or Corne. To ensure that taxes aren't regressive, what are some of the supportive policy actions that governments should consider to mitigate the perceived risks of reduction in consumption of products?
I'll take the first stab at it, and Corne can jump in. Can I just go back to the previous question?
Sure.
Because I think just to add to what Adam and Marianne have said, and Sarah as well, it's just political cover. This just gives more political cover to governments, right? If this is coming from like a big multilateral agreement, then they can point to it and say, oh, I have to do this. This is something mandated from, this broad international agreement. And I think it can be really powerful tool. We've absolutely, personally witnessed that this is a powerful tool. As for how we deal with regressivity, as I said, at a population level, these types of taxes tend to be very progressive because we see so much less consumption from those in lower income groups and young people as well. So, one of the things that we've seen with tobacco is that you take some of the money and you put it into primary care programs to make sure that you have physicians asking people if they smoke and do they want to quit. Like really simple interventions that don't frankly require that many resources. But really, if you look at the WHO recent global tobacco control report, a lot of countries aren't doing this really basic stuff, and they can't. And so there are a lot of things that we can be doing programmatically that don't cost a lot of money, that we can use some of these new tax revenues to work helping the most vulnerable folks use these products less. But I'll hand it over to Corne.
So
We get just very quickly, Corne, because we're going to have to wrap up.
Yeah. So in terms of the regressivity of the tax, My response would be slightly different. Well, no, not different, additional to that, and that is cigarette consumption or tobacco consumption in itself is regressive. It causes illness. It causes people to lose loved ones. And if that is concentrated amongst the poor, that means that the inequalities that is being caused by tobacco is disproportionately carried by the poor. So if one can in some way or another reduce the consumption of tobacco, we tend to find, and the evidence is very strong for this, that if there is a price increase, the poor are going to reduce their consumption by a greater percentage than the rich. So that is already going to somehow cause a decrease in the regressiveness of the tax. May I quickly talk about earmarking, because so many comments have been about earmarking, and this also relates to this. Earmarking in many countries, especially in the ministries of finance, is a bit of a swear word. So I think we need to acknowledge that ministries of finance typically don't like earmarking. In my country specifically, South Africa, it's really not something that is being considered. But some countries have done extremely well with earmarking. I'm thinking about countries like Panama. 50% of their tax revenues is earmarked for cancer treatment, for what do you call it, controlling tobacco, etc. In countries like Jamaica, their national health insurance system, they've got a sort of a national health insurance system, light, if you can use that terminology for it, that is based nearly exclusively on the earmarking of taxation on both tobacco and on alcohol. I needed to get that in there. Sorry about that, Adam, but it's important.
No, absolutely. Thank you very much. All right, we're going to wrap up. We just have another minute or two. Wanted to call your attention, everyone. Thank you for being here for this briefing. Thanks for all the questions. The report that we've been referring to is available now on that website. Yeah, and you can check the QR code. We also wanted to draw attention to the calculator that Marianne referenced earlier. This was created as a collaboration between the Economics for Health team at Johns Hopkins, Vital Strategies, and the American Cancer Society. And there it is. And there was a question about how to do those estimations, and this is a tool for doing that revenue calculations. Between now and the UN General Assembly that was referenced, there'll be a lot of events and more tools coming out. I'll draw attention to something that Vital Strategies and partners will be releasing, an action guide on health taxes. Sarah referenced the need to build trust and communication strategies and strategies for building political will. This action guide is going to contain useful information, country experience, and practical guidance for getting from that evidence to action that we were talking about before. There'll be some side events and much more on health taxes at the UNGA in September. And wanted to call also attention to the World Health Organization's Health Taxes Initiative called 3x35, calling on countries to raise prices of these three products, tobacco, alcohol, and sugary drinks, by at least 50% by 2035. And you can find information about that campaign on the WHO website. There'll be events throughout the next couple of months. We'll be sharing a recording of this webinar and a link to the report. And I'll just turn it right over for the last word to Marianne.
Thank you so much, Adam. So what I want to end with is action and a call to action for all of us. So first of all, again, thank you for joining the webinar. There were so many great questions. We couldn't answer them all. What I am asking you to do is definitely download, the brief, share with your networks. We will also be following up as we can, as you left your names, to answer some of these specific questions. I think the other action for all of the journalists on the call, again, please spread the word on the discussion we've had here today. You've heard how important it is to bring public into this dialogue, to be able to create coalition, to be able to provide political cover so our leaders can do the right thing. We also know that right now countries are negotiating what's going to be in that final document that will be part of the political declaration in the September high-level meeting. So now is the critical time to put pressure on our governments to make sure that language for commitments for health taxes is included and is strong, so that, as we said in the beginning, when we do have health taxes, they're really optimizing and maximizing public health benefit. The last challenge I want to put down, as I mentioned, there is language on health taxes that came out of the 4th International Conference on Financing for Development in Sevilla. Our finance counterparts have done their job. Now's the time for the public health community to really rally around these commitments and make sure that the language is in the high-level document in September, so we can have this extra lever for pushing on health taxes in countries, and we can secure those gains, especially as they relate to saving lives. So thank you so much, everybody, for joining. Please continue to engage. We are here to help connect the dots and make sure folks have what they need in order to get the job done. Thank you.
Thanks to all our panelists, and have a good day, everyone.